what's up, everybody? Welcome back to Nursing Uncharted, the podcast that delves into all the different ways that we can use this license while having uncharted conversations in the process. I'm Maggie Reichard, pronouns she, her. I'm your host for this podcast. Thank you so much for listening today. If you are new listeners, welcome. We're excited to have you here. And old listeners, thank you so much for coming back. Wherever you're listening, give us some feedback on how we're doing, whether that be YouTube comments or, on our Instagram at AMN Nurse. We love to hear that feedback. Also, Apple Podcasts, we're on there. Go ahead and leave us a review. We're on Spotify as well. We're everywhere. So this episode today is a really fun one. It's just me, actually. And I wanted to talk about improving communication between nurses and doctors. It's something that I'm really passionate about. It's a topic that breeds a lot of distress. Before we get started, this episode is sponsored by AMN Passport. AMN Passport is a highly rated app that AMN has created for travel nurses or prospective travelers, and it helps you find assignments, book assignments, and manage everything all from your phone. It puts you in the fast track for your next travel job. You receive instant job match notifications when you download AMN Passport. So if you're interested in travel nursing, be sure to check it out. So today, I want to talk about improving communication between nurses and doctors. It's a really distressing topic for some people. Nurses get distressed when we feel like what's best for the patient isn't happening and we're not being heard. And I've seen so many moments where distress could be dissipated if the communication from both sides was just a little bit better. Our work environment is such a high stress work environment for everyone around. There are a lot of stressors and they build up. And if you don't deal with that build up, it can manifest into physiological symptoms. It weighs on you long term. So we need to give ourselves the skills to deal with that stress. And one way to do that is improving our communication with each other. There are a lot of circumstances where teams don't get along. Everybody you work with has learned from different experiences with other coworkers, and everybody brings those experiences and their own biases into the job, and how they communicate with others is, built upon that. You can have one seasoned nurse who feels like they're never listened to by residents or interns. And so, in turn, they never give the interns the time of day. And then that intern, learns that nurses hate working with interns. Nurses are hard to work with. And so that stays with them as they become residents and more seasoned physicians. And so, they turn into residents that don't appreciate the input of nurses. And then they leave nurses out of communication because they think they're hard to work with. It's a vicious cycle, and it leads to burnout on all sides and stress. And you feel like what you're doing doesn't matter because you're not being, you don't have input in what you're doing. And the person that really loses out in that situation is the patient. I mean, the patient is the one who suffers. If somebody has a good idea, if a nurse has a good idea or isn't asking questions because she feels like she's not being heard and communication is dropped, then the patient suffers. So here is what I found. I feel like I'm pretty good at communicating with doctors. I've been a nurse for 9 years. I've worked in a lot of different environments, hostile and healthy. And, so I figured I'd share some things that I do to optimize my communication. And I don't do all these things all the time. I'm not perfect. I'm a very passive person. So confronting people, I'm very conflict avoidant at all costs. Something that doesn't serve me though. So I'm, something that I continue to work on. So I'll make sure to say that, but these tips in total, they will help you improve your communication if you implement them. So the first thing that you have to set the foundation for is respect. I maintain respect. I have the utmost respect for doctors, for my nurse practitioners, for my PAs. Do they always make the right decisions, in my opinion? No. Can I still treat them with respect and professionalism? Absolutely. That is the key to maintaining a good rapport, even when you don't agree. Say thank you, just talk in a professional manner. You just maintain, you have to have that baseline level of respect. So that's a very first thing, kind of short and sweet. The second thing, don't assume. I try not to assume that I know what they're doing at that very moment when they're not answering my pages, because I don't know what they're doing. It's a different specialty. I've never been oriented to that workflow, so I can't speak to what their priorities are in a day. I can't just assume that they're sitting back there, not doing anything, not answering my page, because honestly, that's probably not what they're doing. They have different responsibilities than nurses do. And even if they are sitting, at a computer back there, they are probably in the middle of something, and they've prioritized my page under something else. If they're a newer doctor, if they're on orientation, or they're, a younger resident, they might have to get somebody else's opinion on my question that I might have. So it might take a little bit longer. They might be in surgery, and this isn't to say that younger LIPs don't need coaching on prioritization skills. They totally do. They need to learn. It is helpful to get feedback from the team, from the nurses, but there is a way to do it that maintains professionalism, that conveys what you're trying to say, and keeps a level of respect for everybody. If you feel like you wish a situation would have been handled quicker, then open up that communication to that doctor. Tell them why you're concerned. If it's something that can't wait, I'll try to explain what's giving me extra distress. Don't ever stay in that distress. Staying in that moment of moral distress or anxiety that nobody is listening to you and you're concerned about the patient will burn you out. Absolutely. It's not a good feeling, and it leads you to trusting no one but yourself, which is not a good place to be. If you feel like there's a pit in your stomach about something, then you have to tell somebody about it. It's best to tell that person that's involved, and you have to do it with a level of respect and open communication and humility to what you're saying. But if they're not listening, then you absolutely can go up the chain. So it could look something like this. I wanted to do a couple of kind of scenarios in this episode. And some of these things are things that I've experienced. Some of these things are things that I've seen other people experience before, and ways that I've learned in these circumstances. So it could look something like this. So your patient has a neuro change. Let's say that they're intubated. They have a RASS of -4, meaning that they're heavily sedated for my, med-surg acute care nurses. And their pupils seem a little more sluggish. They're on high amounts of sedation. So you page the intern and you say that pupils are now 4 and sluggish. They get the page. They know that high amounts of sedation and a deeper RASS score will cause somebody's pupillary response to slow. So they don't page you back, because in their head, they've already solved this puzzle already. You don't get a response. You're still concerned. So you go tell the charge nurse, and you should be telling the charge nurse about any concerns that you have, assessment changes, communication fallouts, whatever is giving you that pit feeling. Charge is a seasoned nurse. They should be. Let's all hope that they are a seasoned nurse. And, most of the time they are. And they might be able to give you that peace of mind, that piece of information, and let you know that, somebody on high amounts of sedation might have a slower pupillary response. But even so, a resident not answering a page is not okay. It's not professional, and that loop of communication needs to be closed. They need to learn that it needs to be closed. So this is what you do. You take a deep breath, you give them the benefit of the doubt, you stay respectful, and you page them again and say, hey, I'm concerned about this neuro change. What are your thoughts on the pupils slowing? Boom. You're concerned, you're respectful, and it's a question, not a FYI page, which will prompt them again to answer you. And neuro changes need to be taken seriously. So it's a learning process. You just have to be respectful when they are, in that learning process. And it might be that you know the answer to that question that you're looking for, but you do need to run it by the team. You can't just, notice a neuro change, nobody pages you back, and then you decide, it must be fine. Because again, don't assume, because there's always a possibility that your concern is right and, that they've got a new head bleed or something and you were the first one to catch that neuro change, but nobody took you seriously. There were other reasons for pupillary responses. It was your assessment, and don't just assume it was wrong or shouldn't be prioritized because you didn't get a response. That's why you should always get an answer from the docs, whether or not it is a problem. Okay, we are maintaining respect. We're not assuming. The third thing that I've thought of, go talk to them in person whenever you can, as opposed to texting or paging them. We all know that tone of voice isn't heard in texts, and things get misconstrued a lot of the time. I text with exclamation points. I know that might not be on brand for other people as much as it is for me, but at the very least, try to use punctuation where you can to help convey a respectful and a friendly tone, because it does go a long way. Face-to-face communication is so much better for this, though. I got this tip actually from Megan Pribish. She was a nurse for our labor and delivery episode. She talked about going up and talking to the residents face-to-face and how much that improved her rapport with them. And it's so true, because then they can put a face to the name. Maybe you can talk about something other than work for a second and bring back that human interaction aspect. I tend to get tunnel vision a lot of the times with my patients. Like, I can't focus on anything else. These people are here strictly, for work. And I've definitely just gone in, told them about a problem and left. And that's like kind of a robotic way of interacting with your coworkers. You don't have to be like that. You can add little bits of small talk here and there. And, and in doing that, I think that also makes things less accusatory too. It takes the heat out of a situation when you're not like beelining into the physician's workroom with a problem. If it's appropriate, obviously if someone is like hemorrhaging, you're not going to mosey on into the workroom and be like, hey, what'd you do this weekend? By the way, 82's abdomen is like huge and his maps are dropping. Like, everything has a time and a place, but making small talk here and there, it builds rapport and it does really go a long way. Are you interested in taking your nursing career to the next level? B.E. Smith, an AMN Healthcare company, is looking for qualified nurses to fill exclusive interim unit supervisor roles. This could be the travel opportunity you've been looking for, so apply now while positions are available. Click the link in the description box to contact a recruiter today. Okay, the next thing, give them insight into the nurse's workflow. This helps doctors learn, and it will help with their communication for other nurses. This has the ability to change communication on a larger scale for more nurses than just you. And this happened to me the other day. And I didn't respond to it the way that I should have, but in reflecting on it, I'm going to make sure that I respond differently next time, because it's important for them to know my workflow. And with this, intern, I want to give her a better understanding of what I do and where my priorities are. So I had a new admit who had an AKI, acute kidney injury, and they ordered a bicarb drip and a fluid bolus. I got the bicarb drip going. I got the fluid bolus going. I was in communication with the intern because they were assessing the patient. They were in there, doing their admission stuff. They left. And then a little later, renal came. They saw the patient. They put in their recommendations, was to change the concentration of the bicarb drip, and they ordered another fluid bolus. We were trying to flush out this patient's kidneys. So the bicarb drip comes from pharmacy. You can't just hang that. You have to wait for it. And it takes a while. And this person also had terrible IV access, just your like run-of-the-mill chronic kidney disease patient. So like one arm has a fistula and the other arm has just terrible veins. So I was putting her bicarb drip, her fluid bolus, and antibiotics all into this little trooper of a 20 gauge peripheral IV. So we are having terrible time getting access. So, but in the back of my mind, I have this like bicarb concentration change that pharmacy is coming up. I have another fluid bolus. So a little later, probably like an hour later, I got a call from the intern saying, "Hey, I'm not sure if you saw, but I changed the concentration of the bicarb drip and I ordered another fluid bolus." And it seemed a little passive aggressive to me. I was immediately a little put off by her calling because as a diligent nurse, obviously I saw those orders and I'm not just sitting on my ass looking at those orders being like, I'll get to it. Like I'm actively working on completing those orders. I know it had been an hour, but pharmacy was still working on that new concentration and someone else was in there trying to get an IV so I could hang another bolus. And like I said, I'm not perfect. I didn't respond to this perfectly. I just said, "I know, I saw them." And she said, "Okay," and hung up. So I should have closed that loop of communication, explaining to her my workflow and what was the holdup on those things. Because in her eyes, I never answered her concern that maybe I'm just sitting at the desk saying, "I'll get to it." And that's not what I was doing. I had all these other things to think about. So, and that doesn't help her learn because she might feel like she has to passive aggressively make more calls to different nurses too. And I'm sure she doesn't want to do that. And she shouldn't feel like she has to do that. It puts stress on her. So give them insight into your workflow when you can. It's going to be better for everybody. Okay. So we have baseline level of respect. We're not making assumptions. We are talking to people face to face instead of paging when we can. We are explaining our workflow so that there's a better understanding. What happens if an LIP is rude to you? Let's do a scenario. So you're working on the floor. You have a COPD patient who came in with COPD exacerbation. They're non-compliant with their home. Now I'm blanking if they have home BiPAPs or if they wear CPAPs. Anyway, they're not compliant with their setup at home, and they won't wear a BiPAP at night in the hospital, even though their CO2 levels are climbing. So you see the NP. You let them know that they're refusing to wear their BiPAP and their oxygen is 85%. Maybe they live there, at home with chronic COPD. It's not too far off from their baseline. Sometimes those patients live like 88% all the time. So, maybe it's not too far off. He's not in distress, so the NP isn't prioritizing it. He's already got a nasal cannula on, but you're concerned, so maybe you page them again and you hit a nerve with the NP and they say, "Just put a Salter on him. Do you know how to do that?" The shade, trying to peg you as incompetent. Don't stay in that distress. The best thing to do is face that person. It might be scary. It is scary. Trust me, as a conflict avoidant person, I feel like I'm going to throw up when I do this because you might just be used to letting it go. But in reality, you don't let it go. You might think about it later. You might ruminate on it for much longer than you should. It might prevent you from going to that NP in the future, which is not good for your patients. And the NP might get used to talking to nurses in that condescending manner. You got to nip it in the bud. If you want to embarrass the crap out of this nurse practitioner, you call them out on their unprofessionalism in a professional way. You pull them aside when they're alone and you say, "Hey, so-and-so, I need to let you know that the way that you spoke to me regarding 82 and putting a Salter on them was unprofessional. I am a competent nurse with a concern. I came to you respectfully, and I deserve that respect to be reciprocated. They will look like a dumbass because they are the LIP. They should be holding the highest level of respect, and you shouldn't have to be the bigger person. You have to have that underlying level of respect, though, and you have to speak to people with that professionalism and respect in order for this to work, in order for them to reciprocate it. If you spoke to them with respect about a concern, and they snap back at you, you absolutely have grounds to confront them about it. And you'll also feel amazing for standing up for yourself. And you can tell the oncoming RN in the morning or at night about it. But I assure you the NP, the LIP will speak to you differently next time. Okay. The last tidbit that I can think of, which probably should have been one of the first things that I talked about, but I'm just thinking of it now, is truly using SBAR. SBAR, everybody listening should know what SBAR is, but if you don't know what it is, it's a method of communication with team members that helps map out exactly how you should be conveying information. So SBAR stands for Situation, Background, Assessment, Recommendation. And, seasoned nurses that's something that they just kind of have in the back of your head. And the more that you use it, the more, the less you have to consciously be aware of what you're saying. But as a new nurse, or even when you're frazzled, you might shoot somebody a quick page and not have all of the parts. And then, your LIPs they don't have all the information. Like, they are looking at a bunch of different patients. So it really helps to know who you're talking about, why you're concerned, what the background is and what your recommendation is. And they can, put the pieces together, and it just makes for great communication. So don't, I think I remember, in nursing school or in the beginning, kind of like harping on it. Like, do people really do this? But it's a great way. You have to set up your communication that way. So this is an example. So let's say situation. You say, hey, so-and-so, I have a question about 82. I've noticed that his maps are a little softer than his baseline. Background. This is the patient who came in with sepsis from his port. Assessment looks like you do the work. So you go into the chart and you look at what the blood pressures have been. So looks like his maps have been hanging out in the 80s the last few days, but now they're around a map of 65. I know that we increased his metoprolol yesterday to combat some atrial fibrillation, and I'm wondering if it's having an effect on his maps. You do the work beforehand. So the recommendation could be, do you think that could be playing a role in the lower maps, or do you think that he could be brewing a worsening sepsis picture? Be specific with what you're asking. Be concise. You want to paint the whole picture of why you're concerned. And you got to make sure to do the research that you need to on your patient before you ask the question. Don't just say, hey, 82's maps are 65. Because they don't know the context. And in reality, blood pressure goal is he's at the goal. They're technically at their goal. So, if the docs have a bunch of patients to get through, it seems like that patient is stable. So they might prioritize them wrong. If you feel like you can't put everything you want into a text too, then just say, can you call me real quick to talk about so-and-so? And then you can give them your spiel. Trim the fat on what you're trying to say, be concise, but give them all the information you need that they would need to see your concern. Okay, so as a recap, for better communication, be respectful always. Don't make assumptions about your LIPs. Face-to-face communication is better. Give them insight onto your workflow. Professionally address any rudeness and use SBAR. I think if we implemented all of these strategies, imagine what the work culture we could have. It is possible. You just have to implement these things. You have to be the change that we want to see on our units. So let me know what has worked for you in the past, or if there are any I should add to this list. Let me hear your stories about how you effectively communicate with your team and what's worked for you. So that's all I have for you guys today. Thank you guys so much for listening, and take care of yourself. That brings us to the end of the show. Thanks for tuning in to Nursing Uncharted. To learn more about today's episode, make sure to explore the show notes at americanmobile.com/nursinguncharted. And don't forget to subscribe so you never miss a guest. If you're a nurse interested in traveling, visit americanmobile.com to explore the largest database of travel nursing jobs in the industry and the amazing benefits that American Mobile has to offer. Also, a special thanks to producer Jonathan Carey, assistant producers Katie Schraubin and Sam McKay, and Aiden Dykes for the music and editing. Until next time, take care of yourself.